AM 1480 WLEA Hornell. Breaking into our regular programming, there's a press conference just beginning now with the Steuben County Public Health Department and the Department of Emergency Services about COVID-19 in Steuben County.
We're going to have a briefing this afternoon in regards to our COVID-19 response, and we're going to start with Darlene Smith, our Public Health Director, to give you a current update on our current situation.
Good afternoon. I'll let you know what the data is as of right now. We have 40 confirmed positive cases of COVID-19. Having said that, the number will go up today. We have some other ones that we are investigating, but our investigation is not complete yet, so we will release that later when we are done with that. But as of right now, it stands at 40. We've completed 365 tests in the county for COVID. 289 of those have come back negative, thankfully. We have 177 individuals in isolation and quarantine. We have 8 who have recovered from COVID-19. And with profound sadness, we want to say that this morning we were notified of one COVID-related death, and it was an individual that we did have in isolation. We also have in the hospital at this time 11 individuals.
And before we get into questions, one of the things that we'd like to do some messaging on today and really stress is we know folks, are really trying their best with social distancing. We know, it's tough. It's tough on all of us as the weeks go by. It becomes more difficult for all of us to comply, and do so in a good frame of mind. But this is a marathon, as many people have said before. It's not a sprint. People need to really focus on all of their social distancing efforts. There are essential businesses that remain open, and that people do need to get groceries. People do need to go to the pharmacy. One of the things that we're really experiencing right now, and we're hearing more and more tales of here at the EOC with people reporting, is groups getting together to shop for their groceries together. People taking, every member of their family together to get out and to go grocery shopping. That is not social distancing. That is not a safe practice. People really need to limit, buy enough supplies to last you the week or 2 weeks. Don't go grocery shopping every day. That is not essential. People need to plan a little more. Our grocery stores and our larger retailers that have to remain open are very, very busy. And it's very troubling. I'll speak for myself personally, that practice is continuing. I think people are getting the message. You and the media are doing a tremendous job helping us spread that message, but not that the residents weren't taking this seriously before, but we have our first death. I mean, it's a sobering moment here in the county. This is real. People need to take all appropriate measures to limit their public exposure.
And what I think sometimes people forget when they are going to the grocery store, because it is one of those essential services that remains open, by them going in groups and lingering and loitering and spending time in there, it's putting those essential workers at risk. And if enough of them end up with symptoms or testing positive for COVID, then there's going to be a problem even staffing that essential service. So there's that side of it that I wish and I hope that residents would think about when they're congregating in that way.
So one of the other things that you're seeing across the nation, and you're hearing a lot on the news, is the supply chain issue. Certainly, this is not an event that's limited to our region or our area. This is a national and international event that has actually been going on for several months now, all the way back to, December in the start in China, and coming across Europe and Asia, now to the United States. So one of the biggest issues that we struggle with and are working on is the supply chain issue. Working with state and federal partners to try to push supplies out to the hospitals, the nursing homes, and other agencies and entities. Unfortunately, there's just not enough supplies to be had that are out there that can go to the people that need them right now. And there are severe shortages, and you're probably seeing that in the news and on social media. And we're working very closely with our state partners to try to push supplies out as we receive them. We've pushed out a good majority of all of the stock that's been provided to us from the state, as well as our supply that we had in stock over the course of other events that we've had here. So it's important for us to let you know that we are aware of the shortages, and we're doing all we can at the county level to try to work with the state and federal partners to get and push those supplies out to where they're needed. So that's another important piece that we want to share with you and let your listeners and viewers know. So I guess with that, we'll open it up for questions, and I guess we'll start with Ariel.
How did you know? Okay, so first question, I guess, we've seen a significant amount of people testing high in Hornell. Can you address that situation?
Hornell is a hot spot for us right now. I think as we've said before, it only takes a few individuals who have symptoms of COVID, get tested, and then do not go immediately home for the mandatory isolation. And if they stop at the grocery store on the way home or any other number of places, it will dramatically spread the virus. So that's part of what's going on, and it definitely is a hot spot for us, and we're concerned about it. But we're working closely with the medical facilities there and healthcare providers there to try to mitigate.
Thank you.
Brian O'Neill, WLEA.
Go ahead, Brian.
Hornell Fire Chief Frank Brzezowski was on one of our shows this morning, and he spoke about how people who are from the Hornell area who were living currently in New York City and Rochester came back to the area to get away from where they were, and that has contributed to some of the problem. That was what the fire chief said. Wondering, does the public health nurse, Darlene Smith, have any thoughts on that?
I can tell you that we have no knowledge of that. That's the first that I have heard that, so I guess I can't comment. We have no knowledge.
No, and Brian, we have had reports of individuals, a individual off the top of my head that worked in the Rochester area that resided in Hornell, that resides in Hornell. But as far as people coming back from New York City, we have not heard that at all.
Okay, thank you.
How about James Post?
Tim, I think actually the issue of the sort of cluster there in Hornell, that was going to be my question, so I think I'm covered. Thank you.
Yeah, it's very hard to speculate why Hornell's the hot spot. Is it travel? We really don't know.
Yeah, we haven't found a correlation of one individual that, is kind of the spread to multiple others. There's certainly community spread. I mean, Darlene has mentioned it many times before. This isn't just travel related in Steuben County. This is community spread. It's here. But there's no, one common root cause.
Okay, thank you.
Griffin Haas.
Just to clarify and to be sure, the individual who did unfortunately pass, where were they hospitalized, just to be 100% sure?
In the Bath area.
It's Brian O'Neill, WLEA, again with another question.
Go ahead, Brian.
Thank you. Hospitals, all hospitals and all medical facilities, are there any rules for them on whether they are supposed to announce or not announce that they have a COVID-19 patient when that is the case? With this being a new situation, are there any guidelines on that from the state?
Those institutions report to public health when they have positive patients that they have tested and admitted.
Okay.
Hi there, this is Courtney from WHUC in Rochester. Can you hear me?
Hi, Courtney.
Hi, how are you? I think you pretty much covered this, but just to go over it one more time. So why do you guys think that, I guess, Steuben County has so many cases compared to, like, other counties around you guys?
It's unknown at this time. We have not identified a common denominator. As mentioned earlier, from what we can determine, very little of it is related to travel. It is community spread, and I think what we can safely say is we know from our investigations that many people don't follow what they're supposed to do when it comes to staying home, either in a precautionary quarantine status, and more importantly, the mandatory isolation, which are those folks who have symptoms, getting tested, waiting to get tested. They're ill. They have symptoms. They don't feel well, but we get reports that they are out and about getting, I don't know, I suppose their supplies for their isolation. But that is a real problem, and that, I believe has contributed significantly to the rise.
I think the biggest thing to take out of that is the fact that if you are sick, stay home. If you need supplies, contact a friend, a neighbor, a family member, somebody to bring you the supplies that you need. But if you're not feeling well, stay home and don't spread whatever illness you have to the rest of the community.
And I think it would be great to remind residents that I believe almost every grocery store in the area has Instacart and curbside pickup and sometimes even delivery. So there is no need to be going inside the store itself when they could utilize one of those options.
Thank you so much.
You're welcome.
Are there any further questions?
I have a couple. It's Ariel, WETM. First, for people who haven't tested positive and are under quarantine, is there consequences other than obviously spreading the virus, but consequences for breaking quarantine?
There is not a civil or criminal consequence at this time. We have utilized law enforcement to help us out in getting an individual back home to where they belong through an order to show cause, but there's not a lot of teeth behind the original order to stay at home.
Yeah, the good news is once individuals we have staff both in public health and law enforcement that go and check on the positive tested individuals daily to monitor their health, number one, but also to make sure they are home and they are complying. Thus far, we've seen good compliance on that side. It's the individuals who, I'm not feeling well, I go to my primary care or to the ER, I get tested, my tests are pending, but in that interim time, I'm out grocery shopping and going places. That's where we're seeing the issue.
And we've gotten some reports of places that are insisting that their employees work even though they feel like they're considered non-essential. Are there consequences for companies insisting to continue running?
So those essential businesses are all determined by Empire State Development, and there is an Attorney General's a hotline that those individuals can contact if they choose, and all that information is on the web, very easily accessible, and also on our Facebook page. Thankfully, we here at the EOC haven't received a large number of those complaints, but that's where employees, obviously they should contact their HR departments and others, but if there are also other avenues because that is enforced at the state level.
Are you still up against a backlog of testing with tests not available, or has that become less of an issue?
I would say that it's become a little less of an issue. It's not so much that there's a backlog due to testing availability as I think providers are just being careful as to who they test. They don't want to waste, so to speak, a test on someone who just wants to be tested even without symptoms for peace of mind. So I think for the most part, those who need to be tested are getting tested.
Okay, thank you.
You're welcome.
Brian O'Neill, WLEA again.
Go ahead, Brian.
This question for the public health nurse, Darlene Smith. Can you say what medicine or medicines are being used to treat the COVID-19 patients?
There isn't one. I mean, there's not a vaccine. There is not an assigned medication for this virus here locally.
Right. There have been, obviously, as you've seen, some different combinations of medications that have been used in trials in hospital settings. But obviously, Darlene is the public health director, and staff here at the EOC are in communication with the hospitals, but we don't get into the treatment regimen in a hospital setting.
I had another question, if I could.
Sure, Brian.
We had on St. James emergency room had Dr. John Robshaw this morning. Dr. Robshaw said that some, not all, but some cases, usually the toughest cases, the ones who are the worst off of COVID-19 patients, are sent up to Rochester, to Strong there. I'm wondering, are other hospitals in Bath and Corning doing the same, sending the COVID-19 patients to other hospitals sometimes?
Yes, the most acutely ill are very typically sent to their mother hospitals or other regional hospitals.
Sure thing.
I have another question, Ariel Salk. I was talking to a medical official, and they were talking about how patients from New York City are being redistributed throughout the state. So we expect to be getting patients from the city to local hospitals.
We don't know for sure. I believe the one area I have heard that some New York City patients have been moved to is the Albany area, but we have not been contacted to accept any downstate patients.
So now, currently, the governor has a hospital task force at the state level that's coordinating that type of shifting and moving of patients, as well as working on staff mobilization and movement of staff and people. So, those are going to be made probably at the higher level. The Albany situation that Darlene talked about, I understand, was an agreement that a downstate hospital system had with another system from upstate, and that's how those patients were adjusted or moved. But we really don't have any guidance right now about any push of downstate resources to upstate at this point.
Thank you.
Brian O'Neill with another question.
Go ahead, Brian.
This question for the public health nurse, Darlene Smith. Governor Andrew Cuomo and others, I believe Senator Schumer did this too, called on retired doctors and retired nurses who are more recently retired to volunteer to get back into the loop in their local medical worlds. Wondering if are you on the same page with them, Darlene Smith, and are you asking retired nurses, doctors, etc., to get back into the game?
We are. We have what we call Medical Reserve Corps, and we have already we activated that a couple of weeks ago, and we've had probably a half a dozen different medical MRC volunteers come out to assist us, as well as we have recruited back a few retired public health nurses, and they very willingly jumped back in to give us a hand during this very difficult time.
So those those folks that are interested in volunteering can go to either the state website or if they're Steuben County residents, they can go to the Serve Steuben website on the public health page within the county website. It's called Serve Steuben. Any other questions? Well, again, we want to take the opportunity to thank you for taking the time to listen and hear us this afternoon. And again, we want folks to continue to stay home, stay safe. There's no further questions. We'll end the call for today.
Thank you.
Okay, thank you all.
Thank you.
That wraps things up there with the media call today from Steuben County and the Department of Emergency Services and the Department of Public Health. Also, I believe Jack Wheeler might have been in that call, the Steuben County manager. It's AM 1480 WLEA Hornell. We're